Good afternoon, everyone. Thanks so much for joining us today, and welcome to the Alliance's annual federal budget briefing. I'm Julie Klein, and I do federal advocacy work with the National Alliance to End Homelessness. I'll be joined today by other Alliance staff, including Kate Seif, Policy Outreach Coordinator, Steve Berg, Vice President for Programs and Policy, Ian Lisman, Program and Policy Analyst, Sharon McDonald, Director for Families and Youth, and Lisa Stand, Senior Policy Analyst. In this webinar, we're going to talk about the President's fiscal year, commonly abbreviated FY 2015 budget request, which was released on Tuesday. Before we delve into the content of the budget, though, I'd like to point out that in case you would prefer to follow along throughout the webinar using a printed version of the webinar slides, you can access them by following the link to our President's FY 2015 budget briefing page, which is right up on the screen there. And in addition to the slides, you can also find a number of other helpful materials, including a listing of the Alliance's 2014 policy priorities, an FY 2015 budget chart and rundown, links to our FY 2015 McKinney and Veterans Funding campaigns, federal policy briefs and accompanying talking points, and more on this page. If you would like to receive updates after the webinar, make sure you sign up for our campaign lists, and you'll have an opportunity to do so later on in the webinar. Please also note that all of the lines will be muted during this briefing, but if you have questions at any point, you can send them to us through the webinar software. To do so, you'll find a box labeled Questions in the webinar panel at the right side of your screen that you can type your questions into, and we'll go over them at the end. We'll hopefully have enough time at the end of the briefing to answer as many of the questions submitted as possible. And if you have any technical difficulties during the webinar, I would recommend calling in by phone instead of using your computer speakers. If there are any additional issues, please quit and restart the webinar. Okay. The purpose of today's briefing is to learn what's in the President's new budget proposal, how it impacts affordable housing and homelessness, and how we can use this as the foundation to work together to advance some key issues this year. Kate is going to start things off by providing a brief overview of the federal budget and appropriations process. Next, my colleagues will give a rundown of the President's FY 2015 budget proposal for key departments and programs. Steve will then discuss the budget and policy outlook for this year. And then Kate will wrap things up by explaining how you can get involved in preventing and ending homelessness in 2014 through our McKinney and Veterans Funding campaigns and our Never Another Homeless Veteran campaign. And then finally, we'll go through and answer as many of your questions as we can. As you can see, we've got quite a lot to get through in just an hour, so please do bear with us. We promise to budget in enough time at the end for questions, and we'll get to as many as we can. Okay, I'm going to pass this over to my colleague Kate Seif, who will give us an overview of the federal budget and appropriations process.
Thank you, Julie, and thanks everyone for joining us today. Like Julie said, I'm going to go over sort of the general appropriations process, how it's supposed to work, and then sprinkle in a little bit about what I think is going to happen this year. So as you can see on your screen, I have sort of a question about being back to regular order. These last few years have been topsy-turvy, kind of to say the least, in terms of how the appropriations process has gone. And in the past 2 years, it started a little bit late, ended way late. It's kind of been all over the place. But this year, the President's budget is a few weeks late, about 3 weeks late, but we're still, sort of on track here. The President released his budget, as is usually supposed to happen, before Congress begins their serious work on a federal funding or appropriations. So we've started that process off normally. And the President's budget, in normal times usually serves as a benchmark. It's meant to serve as a guide for Congress as it kind of works on its appropriations. The usual process is that at the beginning of the year, early February traditionally, the President will release his budget, and it's a proposal, and it goes program by program with specific proposed funding levels. And then Congress takes that budget and sort of, the House and Senate then sort of adapt it, use it as a guide. It's rarely adopted wholesale, and this year will certainly be no different. Since the President, is of course a Democrat, the congressional Democrats, particularly those in the Democratic-controlled Senate, will be using it more as more of a guideline than the House Republicans might do. Now, the budget that came out is kind of an ideal situation proposal. Obama announced, before he was going to release it, that this was a budget that he would like to pass if all three branches of the government were controlled by the Democratic Party. That's not the case, so there will obviously be some compromises and changes that have to happen along the way. And Steve will be talking about this a little later on in the webinar, but there's a lot in the budget, not just around funding for specific programs. There's a lot around taxes and things like that, reforming the tax code. That doesn't necessarily directly apply to sort of this conversation, but it's a big part of the budget, and it's a big part of the messaging piece of the budget. So that's sort of the context for the normal appropriations process and the President's budget. So one of the big things that's different this year, and was theoretically different last year, but this year we hope it holds true, is that the top line spending level for the federal government, so the overall number that the federal government has to spend for the upcoming fiscal year, has already been decided. It was called the Bipartisan Budget Act, or the Murray-Ryan budget deal. It came out back in December, and it basically set the top line funding level for fiscal year 2015. So we have that number to work with. That's usually the sticking point with these. That's been the sticking point for the last few years. How much money is the federal government going to spend? So hopefully we have that figured out this year. Hopefully that number, that top line number, will stay, and that's what the President, went with. That's what the House and Senate will hopefully go with, and just divide it from there. So the problem is that the number that the Bipartisan Budget Act came out with in December is only $2 billion more in additional funding for all non-defense discretionary programs. So, I mean, to put that in context, last year McKinney-Vento was funded at $2.105 billion. So basically, it's and it's not a huge program. So $2 billion is almost nothing. It's not even pennies a program, I think. It's a really small number. So the Appropriations Committees need to decide then, in the House and Senate, need to decide how they're going to split that money up, and then decide how much each federal department will have to spend, and it won't be that much more than last year. We're looking at a very tight budget where a lot of things will just sort of be flat funded. $2 billion spread over the entire non-defense government is really quite a lot to work with. Sorry, there's some construction noise in the background here, so bear with me if there's some weird background buzz. So again, in a normal order kind of year, the top line number would be agreed upon, and then the Appropriations Committees will sort of take that number and imagine it as a pie, and they'll carve up the pie, delicious federal funding pie, to all the different subcommittees, and the subcommittees represent each federal department, sort of. And then to figure out, how much each of them is going to spend. So then once that's done, the Appropriations Committees, the subcommittees move forward in deciding the specific funding levels for each program. So like I said, then the subcommittees put things together, and in a perfect world, the House and Senate would then agree sort of on a final bill, pass it. It would be signed into law by the President, and that would be that. Like I said, back to regular order this year. The top line spending number that's been decided, the talk among Washington has been that this year we're going to be back to normal. Things are going to proceed fairly normally. However, and it's Washington, D.C., and we're talking about Congress, so there's always going to be a however. There are elections this year. Midterm elections are happening in November. And traditionally in election years, a lot less gets done. I know, even less than Congress usually does is expected to get done this year. So it's really still kind of up in the air. As I note on the screen, it will depend a lot on House leadership. Do they want to push this forward before the elections? Do they think it's too dicey to deal with? Are they going to push it back? Either way, though, the process should look fairly normal. It just might not get finished by the start of the fiscal year on October 1st. So, we'll see, and we'll keep everyone updated on that process. But we're looking at a lot less, cliffs and brinksmanship this year than I think we've seen in the past. So great opportunities to sort of get involved this year. So to go back to the subcommittees, so like I said, there's that pie, and each subcommittee that represents a federal department or a group of federal departments decides what's going to happen there. Oh, did I skip? Oh, sorry. Sorry, moving forward. So the president's budget, to put it in context of all this, it's not law. It's a guide, as I mentioned. So here key is that Congress, as I mentioned, that pie and dividing it and figuring out the program-by-program funding level, that's Congress's decision. And really, you know, they're dealing with so many programs, and they have such a tight budget to work with this year. Again, only that $2 billion extra. So they really need to hear from you to find out, you know, where should that $2 billion go. So we'll be talking a lot more about advocacy, but Congress is going to have to make some extremely tough decisions this year. They do every year, but I mean, we're talking really tight budget, and they need to be hearing from you about, you know, where this funding is going in your communities, the impact it's having, the positive impact it's having. They need to be hearing from you about this, you know, this year while they're making these decisions, so that they can feel confident providing an increase for homeless assistance programs. So with that, I'm going to turn it over to Steve. We're going to jump into the President's budget overview, and he'll be giving kind of his general thoughts on the budget. Steve?
All right, thanks, Kate. And thanks to everyone for joining this call. We've got a good turnout here, and I think that's important because I think this budget is really a statement of proposed priorities. And one of the things we're seeing in there is that the priorities listed in the budget match what people involved in the National Alliance to End Homelessness feel is important as well. So just to give a basic overview on the budget, and then some other people will talk about some of the details. HUD is proposed for an increase of about $1.25 billion. Now, HUD has had three straight years of declines in their budget, with 2011, 2012, 2013 with sequestration. 2014 it started to come back. This proposal for 2015 would not quite get HUD's budget back to where it was in 2010, but it would get it most of the way back, and it would allow some of the larger programs to undo a little more of the damage that was done by sequestration. Much of the increase in HUD is really concentrated on programs that serve the very poorest people, including the HUD homeless assistance programs. In VA, of course, the move to end veterans homelessness is very much on the minds of the administration now, very much on our minds, and this budget really continues to fund that in a realistic manner for the Department of Veterans Affairs, significant new resources for homeless veterans. Finally, Health and Human Services, as people know, there's a number of smaller targeted homeless accounts within Health and Human Services. Some of those are flat funded. The Healthcare for the Homeless program gets a reallocation of some money that was made available in several years ago. There's a complicated story there, which we'll get into more later. Most of what HHS is going to do for homeless people over the next year, I think, is really in the Medicaid program, which is a mandatory spending program, which is not controlled by this budget proposal. Let me just say that the overview of the budget, I think this budget is calculated to give communities a serious shot at being able to end veterans homelessness by the end of 2015 and to end chronic homelessness by the end of 2016. It will still take a lot of work and a lot of tough decision-making by communities, but I think the administration in its priorities has made some tough decisions as well, and one of those decisions is to make the money available to communities to use to meet those goals. Now, of course, the final decision is in Congress, but it's a positive statement about what's going on with homeless providers and homeless programs that the administration and OMB and the various, not just the political appointees, but also the career federal civil service people who are involved in this budget see investments in homelessness as having a very good payoff. So with that, let me turn it back to Kate to start talking about some of the specifics.
Great, thank you. So to jump right in, I'll be covering sort of some of the HUD basics. And I should say, in that link that we put on our on the screen earlier, the President's Budget Briefing, there's actually a budget chart. And if you go to our homepage, you should actually be able to find it in sort of the right-hand side, the library list that has all the funding levels from last year and this year, so you can sort of follow along a little easier. But the big one, of course, for us, and that Steve alluded to, is the McKinney-Vento Homeless Assistance Grant. So in the President's budget, he proposed a 14% increase for the program. Last year it was funded at, as I mentioned earlier, $2.105 billion. And this year the President proposed increasing by $300 million to $2.405 billion. So that's great. That's a huge increase, and it's a big vote of confidence for the program. And it, you know, like Steve said, it basically says this is a priority this year. We want to get this done this year. And actually, Steve wrote a great blog about this today. So if you check out our blog, there's also sort of a little more information on it, and he puts it very well. So the 2.405 includes at least $215 million for ESG. Now, for those of you who follow my alerts so closely, as I'm sure all of you do, you'll note that that's slightly less than the $250 million Congress provided last year in FY 2014. Of course, the 215, there's the caveat of at least in front of it. As is usually the case when they say at least, you know, HUD could choose to provide more depending on how recaptures and COC funding goes and things like that. So that's at least 215. 2.405 billion would fund all renewals from FY 2014, so that's great. So we don't have, there's absolutely no worry of having to make cuts in the COC. This would certainly provide enough funding to cover all renewals from FY 2014. And then there would be additional funds to focus on providing enough permanent supportive housing to meet the goal of ending chronic homelessness by 2016. So that's fantastic news. So the extra money within the continuum of care provided in that 2.405 will go toward permanent supportive housing and the mixture of new units, turnover units, transition, reallocation, and units from other HUD programs should be enough by HUD's estimates to address chronic homelessness completely by the end of 2016. So we think that's fantastic news. Really excited to see that in the budget. You know, we're standing by veterans, and we're great to see that money there. We'll talk a little bit about that. But we're glad to see this focus back on chronic homelessness, and that, you know, we are recognizing that we need to get the job done, and this budget aims to do just that. Going into details on a few other programs, tenant-based rental assistance, also known as the Section 8 Housing Choice Voucher Program. The President proposed funding that at about $20 billion, which is a pretty hefty increase of $868 million over last year's final funding level. And there's an increase in administration fees, which is always popular with PHAs. And there's extra money for new VASH vouchers, which Ian will be talking about a little more in just a minute. There is a, I think, very slight increase for mainstream vouchers. And one key thing here with tenant-based rental assistance that was included in the budget is that the budget proposal estimated that this $20 billion, or just over $20 billion, would be enough to keep all vouchers in existence funded, but also restore some of the vouchers that were cut from sequestration. So this is important, and I should say that we're not quite sure on this. Some of our national partners are possibly a little wary of this. We'll have to see how this plays out. The budget assumes maybe some cost savings measures within reform that will hopefully take place this year to Section 8 that could lead to, you know, some extra money to fill out the sequestration. We're still sort of monitoring that and trying to figure out the numbers and what that might mean. But the administration is making it clear that they do understand that this program was cut from sequestration, and they do want to get back to a point where they get those vouchers back, they get those lost vouchers back. So that's that's good. Not sure, again, if that level will certainly do that, but their heart's in the right place, as it were. So other programs, public housing, capital fund received an increase of about, I think, $50 million. Not very slight increase, about $50 million, which it's a multi-billion-dollar program, so relatively. The operating fund received a $200 million increase. And again, all these numbers are laid out on a budget chart on our website that's a little easier to follow along. I'm just trying to give you sort of a feel for which programs sort of fared well or not so well. Choice neighborhoods and elderly housing got an increase. Elderly housing actually got a fairly significant increase of $54 million. And the budget specifically noted that, this is an important program. As we have an aging population, they want to see this program doing well, expanding, and sort of reversing trends of being cut in previous years. So they're hoping to make it a little more robust again. And the budget also included proposed cuts to CDBG, the Community Development Block Grant Program, and the Home Program. The President's budget often includes these proposed cuts, but they don't usually get through Congress, or they haven't in the last few years. So we'll have to see how that sort of plays out. For the Community Development Block Grant, the administration's budget specifically noted that it's a $230 million decrease, proposed decrease. It proposes various reforms that may lead to some cost-saving measures. It's planning on sort of releasing something that speaks to reforms for that program maybe later this year. So that's sort of a general overview of HUD. We'll be talking more about McKinney in a little bit, but again, we have a lot of budget documents on our website that go into a lot more detail on all these things. This is meant to just be kind of a general feel for the budget and some of the key programs. So with that, that's HUD. I will now pass it along to Ian to talk about the Veterans Affairs.
All right. Thank you, Kate. So, as was mentioned before, there is a fairly significant increase in the VA budget this year, which is great news. The administration is really committed to ending veterans homelessness by the end of 2015, and this significant increase really kind of literally putting their money where their mouth is. And this one actually has a pretty good chance of passing. Congress has been pretty generous to veterans homeless programs over the last few years, so we're hoping this will continue. So as you can see here, we've thrown some of the numbers for the last several years, and there's been a steady decrease. We need a lot more work, and with some of this funding that's hit and some of the increases that will actually be hitting this year, which I'll talk about in a few minutes, should really put the resources on the table that are going to allow this actual dip that we're going to see here. We're currently at 57,800-ish. We need to get down 30,000 or below really to have a realistic chance of really hitting what we're going to call functional zero by the end of 2015, which will be 10,000 or less homeless veterans, and they should all be transitioning into housing of some sort, whether it's rapid rehousing or permanent housing. So the Supportive Services for Veterans Families grant, it's the SSVF program. So this is really where the big increase is coming from. This budget's asking for $500 million. This is a 67% increase over the fiscal year 14 budget, which is at $300 million. And there's a caveat to that, which is the surge funding, which I'm going to talk about here just briefly. So before I move to the surge funding, just SSVF, it's a rapid rehousing program. It's been very successful. The first year's data that's come back showing in the high 80s of people retaining housing a year out. So it's a very successful program, and this is, I think, part of the reason why Congress, in such a bipartisan fashion, is really funding this program at the scale level to actually end veterans homelessness. So like I said, the surge funding here. So this is $300 million. It's coming out. The NOFA is actually still open. So if you want to go to our website, we just did a webinar on the NOFA for COCs, but there's also a one-pager. And so if you haven't applied, this is really a great opportunity to apply. It closes, like I said, on March 14th next week, so the time is kind of running out. And these applications have to be endorsed by the Continuum of Care. This is a great opportunity. This will actually come out of this year's, out of fiscal year 14's funding. So this is not part of the $500 million that's being recommended by VA for the 2015 budget. And then, of course, as was mentioned earlier, the HUD VASH program. So this is split. The HUD budget gets $75 million for the actual vouchers, and then VA gets $321 million to actually case manage the vouchers. So they provide services to the clients. And these are, again, they're focused towards chronically homeless veterans, veterans in the highest need. And this is going to put an additional 10,000 HUD VASH housing vouchers with case management into the mix. So again, this is really pushing forward where we need to be to end veterans homelessness by the end of 2015. There's also the Grant Per Diem program, which is one of the older programs that's been around for quite some time. It's a transitional housing program, and they've been trying to kind of model this program a little bit off the transition in place. So there's kind of things going on in the background of this program. So they're going to continue to fund this program, and they're going to continue to kind of shift the model in a way that's going to suit special populations of veterans and allow them to keep the apartments and the housing that they have through transitional housing, and then it will actually become their permanent housing. So this actually just got a slight increase to $252 million. So there's also, again, this kind of political will that the Veterans Administration gets is this advance appropriation. So they actually appropriate money for fiscal year 2016. And again, this allows programs within VA and grantees outside of VA to actually kind of prepare for coming years, do long-term planning. And again, we're looking ahead to see SSVF, the Rapid Rehousing and Prevention Program, really funded at a scale. So as we house all these veterans, of course, we'll have new veterans coming into the system, and we're going to want to prevent them from becoming homeless in the first place. So over the coming years, especially after 2015, you're really going to see kind of a shift, but the funding is still going to need to be in place because there's still going to be veterans falling into poverty, having housing crises, other type of things. So this kind of commitment to the budget is really showing that the administration is addressing the reality. And then there's also a Department of Labor program that's under the Dole Vets. It's the HVRP, the Homeless Veterans Reintegration Program. This was also in the budget, so this is flat funded at $38 million. So it's a good program. It could be funded at a higher level. So this is something in the past that we've advocated for, actually for Department of Labor to actually ask for more, but it is what it is, at least for now in this budget. And I believe that is my last, yes, so I'm going to hand it over to Sharon now, and Sharon is going to talk about the overview of family and youth programs.
Thanks, Ian. Thanks, everybody. So what we see in the HHS budget for homeless children and youth, once again, we see level funding for the runaway and homeless youth programs. Those are programs that provide basic center or emergency shelter for youth, transitional living, and outreach to vulnerable youth. We really believe that in order to make strides and to do something similar to what is being done with veterans, we need to have a much better sense of homelessness among young people and what their needs are. And so something that's included in the budget that we're excited about is a $2 million request for an incidence and prevalence study of homelessness unaccompanied youth. It's something that we've been advocating for a very long time, and this would provide some of the funding that is needed to really get a sense of who these young people are and how we can best serve them. The education of homeless children and youth is also level funded, and this is a program in the Department of Education that helps young people, children, stay connected to their school of origin. Next slide. So other programs serving families and children that homeless families and at-risk families access is child care and early education programs for young children. So we know about 50% of the children in our shelter programs are under the age of 5 or age 5 and under. So the Child Care Development Block Grant is slated for a slight increase, or the budget proposes one at any rate, at $2.4 billion, and a slight increase to Head Start, which would bring the program to $8.9 billion. Both Child Care and Head Start are oversubscribed for very low-income people, as folks on the front line working with homeless families may attest to. The domestic violence programs, there's a program at HHS which is slated for a $1 million increase, the Family Violence Prevention and Services Program, and level funding for the Violence Against Women Transitional Housing Program, which is in the Department of Justice. Finally, some programs that are serving other vulnerable families is LIHEAP. So this is a program that provides energy assistance to low-income households. That is slated at being funded at a $2.8 billion, which represents an 18% reduction over what the program received in 2014. And the Community Services Block Grant, which provides an array of social service programs, including financial assistance and rent eviction prevention assistance to very low-income or to low-income people in low-income communities, is slated for nearly a cut in half to $350 million from, I don't have the exact number in front of me. I think it was 674 last in FY 2014. Both LIHEAP and the Community Services Block Grant have, in prior years, been proposed by the administration to have significant cuts, and they didn't make it through Congress. So we might see some of that funding restored. And finally, the Promoting Safe and Stable Families program. That is a program that helps child welfare-involved families or those at risk of child welfare to stay connected, preventing a placement of a child into foster care, or to help those in foster care return home, is also level funded. This is $60 million in discretionary funding. It also receives mandatory funding, so in total the program would receive $495 million. But these are critical services that can keep young people from entering foster care in the first place. So those are the highlights, and I will turn it over to Lisa.
Thank you, Sharon, and good afternoon to our webinar participants. Sharon got us started on the HHS, or Department of Health and Human Services, programs, which fund a number of discretionary programs that are key to ending homelessness. The healthcare funding priorities we look at involve key mainstream as well as targeted programs. The administration's budget for fiscal 2015 increases or maintains funding levels for the discretionary healthcare programs that are important to the most vulnerable people experiencing homelessness or who need support recovering in permanent housing. Community health centers, for instance, would have an additional $900 million for a total of $4.6 billion in fiscal year 2015. Now, this amount includes $3.6 billion already committed by the Affordable Care Act and would fund an additional 150 health care center sites. Now, FY 2015 is the last year of this extra ACA, Affordable Care Act funding, and I'm going to come back to this point in a few moments. Based on the $3.6 billion requested for health centers, health care for the homeless projects could receive $400 million, and that's about $83 million more than for this fiscal year. As you can see on this slide also, the Ryan White HIV/AIDS programs are budgeted for $2.323 billion, which is a very slight increase.
The health centers and the HIV/AIDS programs are administered within HHS by the Health Resources and Services Administration. Turning to the behavioral health specifically, the President's budget for our programs next year is completely level compared to 2014. PATH, or Projects for Assistance in Transition from Homelessness, would receive $65 million, and other targeted homeless programs within the Substance Abuse and Mental Health Services Administration account for another $74 million. So this is also the budget that funds services in supportive housing and grants for the benefit of homeless individuals. And the SAMHSA block grant programs are flat for 2015, about $1.8 billion for substance abuse and $484 million for mental health block grants. And I'm going to wrap up with a brief note about implementation of the Affordable Care Act, or ACA. The Medicaid expansion in the ACA is now in effect. As everyone knows, enrollment began last fall, and the first reimbursed services in the new eligibility group were authorized as of January 1. 25 states and the District of Columbia opted into this expansion, and this is, as Steve mentioned earlier, a significant source of resources for homeless assistance in those states. An estimated 4 million, probably more, very vulnerable people, people with severe mental illness and substance use disorders, are left uninsured in the remaining states. At the same time, as I also mentioned, the ACA mandatory funding for community health centers is going to expire after FY15. Health centers, of course, are important access points for primary and behavioral health care services for people who are uninsured and live in underserved areas. So the absence of full 50 states plus DC participation in the Medicaid expansion, there really is going to be a sizable funding gap after next year. And in these budget papers, the administration has advanced one possible answer to this upcoming funding cliff, and that is recommending and saying that it will seek an additional $8.1 billion over 3 more years after the 2015 expiration for community health centers. And I am now going to turn the program back to Steve to talk about budget and policy outlook.
Okay, thanks. So that was the portion of the webinar that gives all the detailed numbers, which I think a lot of people find really useful. And thanks to my colleagues who presented in a way that makes it as understandable as possible. I'm going to spend just a couple of minutes talking a little bit more about sort of some of the politics of where the budget goes from here, and some of the context. Everybody knows that this, as Kate said, and let me repeat, this budget is a proposal. It's not law. Congress passes the law about how much spending there is. So the question is, will this budget is in the circumstances that we're in terms of the overall problems with funding levels coming back from sequestration, still not being enough money to do everything that we think needs to be done. This budget proposal is good on homelessness. It's really good on homelessness. So how do we get Congress to go along with that? And I think that's what a lot of the rest of this conversation is going to be about. The big picture on the process, a lot of things are still coming back from sequestration. I mean, Kate talked about the Murray-Ryan budget agreement that undid some of the sequestration cuts. The sequestration really took effect in fiscal 2013. The Murray-Ryan deal for fiscal 2014 got some of that back and also get some of it back for 2015, which is the budget we're talking about right now. That's the budget the administration just released, is 2015. After that, but that's it for the Murray-Ryan deal. It ends at the end of 2015, and then we're back to having the sequestration cuts, which would keep the funding at the overall government funding at the very low level that it's at now. So the big picture is, in that long-term context, there's still a lot of shortfalls, which means it's a very tough budget for HUD. Even though HUD overall, the budget proposes an increase for HUD, there are certain accounts and some fairly popular accounts that got cut, and those are tough decisions that the administration had to make. And unless they're going to put more money into HUD, Congress is going to have to make similarly tough decisions in order to be able to fund the homeless programs at the level the administration proposes. We believe that's the right priorities, but it's arguable, and many people will argue about it, and Congress will have to make the final decision. As Kate said, this is also an election year that can have various effects on the appropriations process. Meanwhile, we just have to push ahead. I mean, homelessness has always been a bipartisan issue. I mean, this budget talks a lot about putting the money on the table to end chronic homelessness. Well, chronic homelessness was the discussion about ending chronic homelessness and using the HUD homeless programs for that was really something that was started by a very bipartisan group of members of Congress. The Bush administration had a proposal it made ending chronic homelessness a priority. The Obama administration has picked that up while extending it to other populations. This is not something that should get bogged down in partisan conflict. This is something both parties should be able to support, and that's something that we're encouraging people to remind everybody on the Hill. I would just finish this part by saying, before I turn it back over to Kate, I want to finish this by saying this. I mean, I think the homeless services community has a certain reputation among people on Capitol Hill. A hard-won, excellent reputation for doing good things with the money Congress makes available. I mean, the fact that over the course of this recession, when poverty was going up, when doubled-up people were going up, we managed to bring the number of people who are living in shelters and on the streets down year after year through a lot of really hard work and a lot of really tough choices by people on the ground. That's something that I think impresses people in Congress, impresses people across the whole ideological spectrum in Congress, impresses people in both parties. They all want to know that if the federal government is going to spend money, good things are going to happen as a result. And I feel very proud to be able to say that with these homeless programs, that is the reputation these programs have, and that is an appropriate reputation because that is what happens. This year, more than anything, because we're feeling the effects of sequestration, I mean, people just went through the continuum of care application process where they had to tell HUD, these are the programs that if we have to let some programs go, these are the ones we're going to have to let go. That was no fun for anybody. None of these programs are ones we can let go of without it feeling like it's going to hurt. Some of what this budget proposal would do is get some of that funding back and do the extra that's responsible. I mean, we have people who are the most vulnerable people in the country, people with long-term disabilities, people who are veterans who are living on the streets. We have a chance to really have a very serious impact on that, and it really begins with whether a budget like this is going to end up being passed by Congress. So how we do that is what Kate is going to be talking about for the next 10 minutes. So I hope everybody pays careful attention to this and then logs on, signs on, helps us out, figures out ways you can help us with this and help each other with this and how we can help you with this. So with that, let me turn it back to Kate.
Thank you. Okay, so we only have a few minutes left, and we definitely want to make sure to get to questions. So I'll try and get through this. So I think a theme hopefully you've gotten from this call or webinar is that we want you to get involved in this year. We want you to be working with your members of Congress and doing advocacy. So we have a lot of things to make that really easy for you. You can see that link up on your screen. Or if you downloaded the slides, you can click on that link and it'll take you to our advocacy page that has a ton of tools. You can sign up for our email list, and I'll be putting up a poll later on. A lot of you are already involved in our dedicated email list, but I'll give you the opportunity to add yourself to the list in a little bit. But we have a lot of ways that you can get involved, work with us, get our updates. We have lots of tools. We make it as easy for you as possible. So I really do encourage you to get involved this year. A lot of you already are involved, and we very much appreciate it. this would be the year to get others involved. If you're a seasoned advocate, start working with networks and just try and get as many people sort of in the loop and working with their members as possible. So the Alliance has a few top priorities this year. You can see we have many priorities, things that we focus on and policy staff spends its time on. You can see all of our priorities on that link on your screen, including our priorities for working with the administration. But some of the major things that we'll be focusing on this year are, of course, making sure that Congress goes ahead with the administration's proposal and provides $2.405 billion for McKinney. And we're going to also be working to make sure that Congress provides that $1.6 billion, including that $200 million increase for SSVF within VA's homeless assistance programs. And one of the themes sort of running throughout our work this year will be to increase HUD funding in general. We understand that a lot of the programs that help address homelessness are affordable housing programs like TBRA or PBRA or public housing, things like that. We want them to fare well as well, of course. So expanding HUD funding will be another one of our priorities. In terms of campaigns that we'll be running this year, we will, of course, continue our seasoned McKinney-Vento Appropriations campaign for FY 2015, where we will work to make sure that we get that 2.405 in the final congressional funding bills that come out hopefully later this year. You can click on that link or go to that link and you'll see more information on the campaign. But one big thing, we're launching them today. Today is sort of the first day that we're doing our appropriations campaigns and starting it off. And we're going to be starting a letter writing campaign. We do a lot of letter writing campaigns. We usually do about one a fiscal year. And I'm always blown away by the response. So I love doing them because I love counting the numbers and seeing you all, act and get out there and do stuff. So we're launching a letter writing campaign, and we're urging people to send 500 letters. So, I mean, that sounds like a lot, but, if everyone on this call sends 1.5 letters, we'll be good to go. So not a lot. Send more than that, though, for sure. So members are being urged to submit their programmatic requests, which is basically the letters that they send to their colleagues on the Appropriations Committee saying, hey, these are the programs that are important to me, and this is how much I want you to provide for them. Those deadlines are, for the most part, March 31st. So we're trying to get as many of advocates to send as many letters as possible to their members, urging them to write a programmatic request for McKinney. Have your members write their colleagues saying, please provide 2.405 for McKinney funding. And on that campaign page, that link that we have up there, you'll find a sample letter, a sample action alert you can send to your networks. We've made it really quite easy for you, and we can help you with every step of the way. We'll, of course, be sending this out to our McKinney list. And speaking of this, if you aren't already, I'm going to launch a poll about getting involved in the McKinney campaign, and I'll leave it up for just a second. Go ahead and vote now. If you already signed up, feel free to say, yes, sign me up. We won't put you on twice. If you're not sure, I'll probably be following up with you and sending you a little more information on it. Just so you know, this is like just a campaign email. We send about no more than 1 email a week, tops, depending on the time of year, just giving you updates on what the funding levels are, what proposed funding levels would mean, and the best ways to impact the funding process at the time. So I'll leave it up for just a couple more seconds if you want to go ahead and fill out one of the poll questions. And I'll be emailing everyone on the list very soon, within the next day or two, about the letter writing campaign and to kick off our FY 2015 efforts. And we'll be working, of course, to make sure that we get that $2.405 billion for Congress. We make serious progress on that chronic homelessness goal. Okay, and if you don't get a chance to do the poll, which I just closed, you can always email me or get in touch, and we're happy to add you. So again, we'll be sending a lot more information out on McKinney and all that good stuff, and you can always just go to our website to get involved and find out more. Our second big campaign, as I mentioned, is going to be getting that $1.6 billion for the Veterans Affairs homeless assistance programs. And so our veterans work sort of has a two-tiered approach. We have our two-pronged approach. We have our appropriations campaign that's going to be working to secure that $1.6 billion, which includes that SSVF increase. And then we also have another homeless veteran campaign, which is sort of our 2-year initiative to raise awareness and get the word out that we will end veteran homelessness. If we all work together, if we use the funds properly, we can end veteran homelessness by the end of 2015. So the Never Another Homeless Veteran campaign is sort of a public awareness campaign, and there's a pledge to sign, and we haven't signed our pledge yet to end veteran homelessness. We would strongly encourage you to click on that link or go to neveranotherhomelessveteran.org and sign on. And if you'd like to get involved in our dedicated campaign for increased funding, similar to the McKinney campaign, we'll be sending out updates on appropriations when Congress acts, what the proposed funding levels might mean for our efforts to end veteran homelessness and things like that. So I'm going to launch another poll about getting involved in the Veterans campaign, and we will be sending Never Another Homeless Veteran information to this campaign. We'll also be sending appropriations campaign information to those on the Never Another Homeless Veteran. So it's sort of a joint effort, and things will be sort of combined there. So go ahead and fill out the poll. Again, if you're already on the veterans list, we won't add you twice, so you can click yes. And if you aren't sure right now, I will follow up with you and try and get you more information and answer any of your questions you might have. So I'll just leave that up for another minute or two. And I would strongly encourage you, if you haven't already, once again, to go to neveranotherhomelessveteran.org, sign the pledge to end veteran homelessness. We're hoping to get 10,000 signatures. We're well on our way, but if you're not on it, we'd really like you to pledge to end veteran homelessness. I'll go ahead and close that poll. We'll move on. So those are sort of our initiatives this year. That's what we'll be working on. And with that, I'll try and wrap it up and make sure that we leave plenty of time for question and answer. So Julie, if you want to go ahead and start that.
Yeah, definitely. Thanks, Kate. And as a reminder, we'll be sending around the PowerPoint slides and other materials from the webinar very shortly, and we'll also have a recording of the webinar posted as soon as possible on our website. So at this point, we're going to return and respond to some of the questions. So my first question is for Steve or Kate, and this is, could you clarify what the $2.405 billion for McKinney the President proposed would fund? Does it cover additional permanent supportive housing beyond renewals? Yes, it does. Simply put, yes. We're not sure how much. We'll know, I think, like Steve said, we'll know more when the budget justification comes out in the next few weeks. Steve, in a blog today, which you can find on our endhomelessness.org homepage, you'll find more information about that. But yes, there is additional funding on top of renewals. Great. Thanks, Kate. And to go through some more of the HUD questions, is the Alliance doing any more work this year to get more money for HUD in general?
Yes, we are. Glad you asked, Julie. So one thing that's happening right now, and I'm sure a lot of you have heard about this from our national partners or from us, there is a 302B letter. So the 302A is the overall spending level that the government has. So we talked about that. The Bipartisan Budget Act came up with that 302A. But the 302B are those slices of the pie, and those haven't been decided yet. So the overall number is there, but Congress still needs to go in and say, okay, well, how much should HUD get this year? How much should, and this is why all of this matters. So in order to ensure that, McKinney gets as much funding as possible, we need to make sure that HUD gets as much funding as possible. So I'm strongly encouraging everyone on this call today and to spread it to as many partners as possible to sign on to this 302B letter. If you go to that link on your screen, you can easily just enter your organization information or your name and email, and it's done. It's very easy. The letter's up there. You can see it's basically just many organizations coming together to urge Congress to provide as much funding for HUD as possible. I'll leave that up so people can type that into their browser and go sign right now while we finish questions.
Great, thanks, Kate. And speaking of letters, will there be any Dear Colleague members sign-on letters this year?
Yes, we are hoping to get working on that in the next few days. Like I said, those programmatic requests are due by March 31st, so we're expecting to see those start floating around very soon. So we'll be keeping people up to date on all of that.
Great, thanks, Kate. And Steve, this question's for you. Does sequestration impact this budget proposal?
Well, it impacts it partially because, as we said before, the sequestration cuts took full effect in 2013, and then the Murray-Ryan budget agreement sort of restored some of the funding that was cut from sequestration, but not all of it. So I think you'll see, you know, in a couple of different programs. For example, I think in a number of programs you'll see some of the sequestration cuts being put back, but not all of them. So yeah, we're still definitely getting out from under what happened with sequestration.
Great, thanks, Steve. And another question for you is, what is the role of the President's budget proposal this year when a 2-year budget deal already exists? Is there any appetite on Capitol Hill to reopen the budget process?
Yeah, so this is important, and it's sort of a complicated thing. It's best, because when you read the papers about this budget since it came out, there's a lot of stuff about, oh, it's reopening, it's making all these big changes in the law, nobody's going to agree. Congress is not going to agree to that. So it's important to remember two things. The budget does two different things. One is, the important one for us is that it spells out the specifics of how the budget, of how last year's budget deal will be implemented. The Murray-Ryan budget deal didn't give any details about spending. It just set an overall level for spending. And so what this budget, like what the HUD budget does, is it says program by program how much Congress should allocate to each program to total up to that overall spending level. So in that sense, the budget is very relevant because it gives the administration's opinion on that topic. Congress can choose to accept it or do something different, but it at least shows what the agencies who actually have to administer these programs think the programs each need. Then the other part of the budget is a lot of proposals for big changes in the law, big and small changes in the law. Those ones, you know, there's, again, because they would have to be agreed on by Congress and would create changes in the law that already exist, those ones are, you know, frankly going to be harder to do. Some of them may get done anyway, but they'll be harder to do. But the part that's just spelling out the details, that part is very relevant.
Great, thanks, Steve. And Ian, this question's for you. How realistic is the goal of ending homelessness among veterans by 2015? And can you explain what functional zero means?
Certainly. So, yes. Yes to the first part of the question. This is something that is very doable. The resources are falling into place. The political will is there, and so it's you know, it's a lot of work. It's not like it's just going to be a really easy thing, but you know, most of the people out there that I talk to, there's a lot of communities that have, you know, under, you know, a handful of homeless vets in smaller communities, and even some in bigger areas, they've got under 500 homeless vets. So this surge funding coming online, it'll hit in October. We'll be getting the word out, and we'll be really pressing, you know, to really coordinate the entry so veterans are pulled through the system in a cohesive fashion. So if they touch the HUD system, they can get into programs funded by VA. I know we're kind of running out of time here, so. The second part of the question is functional zero. So functional zero is basically the concept that there is enough resources in place for the number of veterans that are still homelessness. They're still experiencing homelessness. So these may be veterans that are waiting on a lease, waiting to get them someplace, but there's enough resources there. So for all intents and purposes, there are zero homeless veterans, even though a veteran may lose his housing. So yes, there's a homeless veteran for a while, but very rapidly that veteran will be placed into housing. So that's the idea of functional zero.
Okay, thanks. And I think we just have time for one final question. And Sharon, this one's for you. What work is the Alliance doing on youth or the Runaway and Homeless Youth Act this year?
What has the Alliance been doing on the runaway and homeless youth? We are working closely with our partners at the National Network for Youth, who is taking the lead, and we're very, very grateful for that, in developing a proposal to reauthorize the Runaway and Homeless Youth Program. We are very interested in making sure that the incidence and prevalence study happens, and so we'll put some effort behind that. I think this could actually be something that becomes almost a public-private partnership if this is something that Congress wants to support. I think there's people in the private foundation world who wants to make sure that this happens, and this can really help us advance our efforts around youth homelessness. I think that the funding for homeless youth programs in HHS has just been flat funded, and we have story after story after story of youth being turned away on a nightly basis, and I mean we have young people outdoors, and it's atrocious. So we do need better data, but we also need to learn from our partners who are working in the field about how they are using their dollars as effectively and as efficiently so they're able to reach as many people as possible so that we can elevate the best practices to members of Congress and show them this is how we can do it effectively if you want to invest more resources, and we encourage you to invest more resources in these vulnerable young people.
Okay, thanks so much, Sharon. So thank you, everyone who submitted questions. I think, unfortunately, that's all the questions we're going to have time to get through today. But if you have any further questions regarding the content of the webinar, again, please don't hesitate to email them to Kate. Okay, thanks again, everyone, for joining our webinar today, and enjoy the rest of your afternoon.